Dr. Lim Wee Kiak.
Mr. Speaker, may I have your permission to address questions 44 to 46 together, please?
Please go ahead.
Sir, arising from the Ministry of Health's regular audits and enforcement actions, 8 telemedicine providers have been or are currently being investigated for non-compliance related to the provision of teleconsultation services. The issues of non-compliance fall largely into 2 categories. 1, lapses in clinical care, such as doctors issuing prescriptions and medical certificates without proper clinical assessment or not conducting video consultations for first-time patients. Or 2, inappropriate advertisements such as those promoting the unnecessary use of telemedicine services. Investigations on 3 of these cases have been concluded and enforcement actions have been taken. One of the cases, which is Mana Doctor, has had its outpatient medical service license revoked. The others involve a short suspension and a stern warning, commensurate with the severity of the breaches. In addition, medical practitioners have also been referred to the Singapore Medical Council, the SMC, for potential lapses in professional standards. SMC's review is currently underway. It's important to recognize that telemedicine can bring tremendous benefits to patients, especially those who are immobile or doing regular follow-ups. It makes healthcare much more accessible and convenient to our patients. And however, as in any new service delivery model, there will be potential for abuse and misuse, especially in the initial period of implementation. MOH will take the necessary enforcement actions so that over time, best practices become normalized. In the meantime, the public should raise concerns regarding the provision of telemedicine to the Ministry of Health via the public feedback channels available on the Ministry's website. So.
Mr. Ang Wei Neng.
Thank you, Speaker, and thank you, SMS, for the reply. Can SMS also elaborate whether they have named the other 2 companies that provided telemedicine and you have taken action, and remaining 5, what is the status of investigation? That's the first question. Second question is, are there cases, how many cases were there where the teleconsult lasts less than a minute? And 2, whether there are cases where there are actually no patient, but they have recorded that were the patient. Thank you.
SMS Janil.
So could I just ask Mr. Ang to repeat his first question? I didn't quite.
The first question is that SMS has said that 3 companies were investigated and taken action for their lapses, right? So we know that 1 is mentioned in 1 or 2 is mentioned in the press. How about the other company? And the second part is that of the remaining 5 that were investigated, what was the status of the investigation?
So some of the investigations are still ongoing, so I don't think I can answer the second part of the first question that Mr. Ang had asked. There are a number of licensees involved, and indeed there were some very short teleconsultations. As I say, the investigations are still ongoing, so we're trying to establish the exact number. A short teleconsultation isn't automatically incorrect if it's a regular patient, if it's a follow-up, if the necessary information has been obtained. So I think we have to look at the entire clinical care that has been provided and make sure it is appropriate. It's not the fact of telemedicine that is necessarily the problem. It's whether correct clinical care has been provided through this modality. And that sometimes requires an inpatient consultation. Sometimes it requires the appropriate breadth and time for the interaction so that the correct information is provided. And in some cases, it is an issue of whether or not the correct documentation of the process has been carried out. So all of these things are part of the investigation process.
Mr. Sharael Taha.
Thank you, Speaker, and thank you, SMS, for your reply. And I agree with the benefits of telemedicine. I have 2 SQs. SMS has shared that it telemedicine providers are under investigation. How many clinics offer these services? Just to get a feel of what is the percentage of these providers are under investigation. Second, some of my residents in Pasir Ris have brought up that the context of telemedicine clinics have been shared as a means to get easy MCs. In fact, a concerned parent shared that some students are using this as a means to avoid taking tests. So how do we monitor that this modern convenience, the telemedicine services, is not abused, and how do you then proactively monitor it? What are the avenues for us to report such cases? Thank you.
SMS Janil.
So to answer Mr. Sharael Taha's first question, in 2024, we received a total of 59 complaints regarding telemedicine, and this involved more than 20 licensees. So that's the sort of the numbers that we're dealing with. The monitoring of the quality of care is an important issue that he brought up, Mr. Sharael Taha brought up. There are a variety of ways that we can do this. Some of it is through the professional route, and some of it is through public complaints. The issue of whether or not a clinical provider is being abused for the purposes of an MC that may or may not be necessary. Again, it's not a telemedicine issue. This type of inappropriate use can occur in person as well. And so there are a variety of things we look at, the metrics in terms of the numbers, the type of patient mix, and the justifications for the medical certificate or any other therapeutic intervention. Ultimately, has a correct assessment been provided, and is the treatment, whether it's medication, investigation, or a medical certificate, appropriate to the clinical condition that has been detected and appropriately documented?